Hello, LU family. My name is Dr. Tanya Lambert. I'm a fibroid health coach and women's health educator. So in this video, I will be sharing with you what exactly is the IUD and how it helps to reduce symptoms of painful periods in women with endometriosis. Now, this topic is very important to me because while I was on my fibroid healing journey, I also had another condition called an endometrioma. And an endometrioma is actually one of the most severe forms of endometriosis. But before I get into this topic, I would first like to share my disclaimer with you. All of the information that I provide in my videos are strictly educational and informational. None of the information that I provide should be used to substitute medical advice. If you have any questions pertaining to your own personal health care needs or prescriptions or medications, please see your licensed medical provider. All right, let's get into this exciting topic. So many of you know that I suffered from severe uterine fibroids. But what I did not mention previously was that I also had an endometrial cyst known as an endometrioma. Now, the endometrioma is one of the most severe forms of endometriosis. Now, when I was suffering from heavy bleeding due to uterine fibroids, I actually didn't know that I had an endometrioma, aside from the fact that occasionally I would have very severe menstrual cramps during my period, particularly on day 3 or 4. So when I went to get my MRI, it was found incidentally or by accident, essentially, that I had an endometrioma. Now, the colloquial term for that is called a chocolate cyst. But what exactly is an endometrioma? As I said previously, it is one of the more severe forms of endometriosis. Now, endometriosis is a condition in which tissue similar to the endometrial lining, which lines the cavity of a woman's uterus, is actually found in other areas of the female body outside of the uterus. So that can actually include the fallopian tubes, the ovaries, the abdominal cavity, and even on the surface of the uterus, or on the outer surface of the uterus. Now, the cause of endometriosis is unknown. It is thought that endometriosis could be due to estrogen dominance, similar to the condition of fibroids. And I have to mention this because many times women that have fibroids may also have endometriosis, and both conditions are related to estrogen dominance. Now, with endometriosis, it is thought that the reason why the tissue from the uterus is found outside of the uterus is due to retrograde menstrual bleeding, in which the tissue from the uterus or the endometrium bleeds in a backward way. Instead of going out of the uterus through the vagina, it actually goes into the fallopian tube and into the abdominal cavity. Now, when the endometrial tissue is found outside of the uterus, in particular in the ovary, the abdominal cavity, it actually responds to the hormones of the female reproductive system and undergoes its own menstrual cycle, in which the tissues in the ovary or in the abdominal cavity can bleed. These tissues then experience inflammation and then they scar, which results in symptoms such as chronic pain, painful menstrual periods, pain during or after sex, fatigue, chronic pelvic pain, and even infertility. So endometriosis is a very serious health condition, and it's so important that you have the tools that you need in order to combat it. So I want to mention that the content of my channel is primarily dedicated to women that have fibroids, to help them to get high quality information from both a medical and a natural perspective to help them on their healing journey. So the focus of my channel won't be endometriosis, but this topic is very important because many times women with fibroids also have endometriosis. And I also had a form of endometriosis called an endometrioma. So it is important that I mention this topic in this video, and also a few medical options that are typically used for women that have endometriosis. Now, I would like to speak with you about the commonly used medical therapy for endometriosis called the IUD. The IUD is a T-shaped structure that is inserted into the uterus by a licensed medical professional to help reduce painful periods in women that have endometriosis. So there are two main types of IUDs. There is the hormonal IUD, also known as Mirena, and the non-hormonal IUD, known as the copper IUD. The hormonal IUD actually uses a synthetic form of progesterone called progestin. How it works is it reduces or thins the cervical mucus and also thins the lining of the endometrium, which is going to prevent the implantation of a fertilized egg and therefore prevent pregnancy. So the IUDs typically are used as a form of contraception to prevent pregnancy, but it is also used to help with symptoms of endometriosis. Now, how the IUD works to help with endometriosis is that it helps to reduce the severity of menstrual periods and potentially even stop them. Now, this could be good in terms of alleviating your symptoms, but it's not good in that it actually stops a normal functioning of the female body, which is to have a menstrual period. However, in the case of endometriosis, in order for you to get proper relief from the symptoms, you would have to ascertain the root cause, change your diet and lifestyle to get relief from the symptoms. Now, the hormonal IUD is typically not used for women who have sensitivities to estrogen or who can't use estrogen therapies, who are at higher risk of blood clots or even suffer from migraines. Now, taking the IUD is not without risk. Some women actually experience dizziness, pain at the insertion site, and even bleeding shortly after it has been inserted into their uterus. Other side effects of the IUD can also include bleeding between periods, no period, heavy periods, chronic pelvic pain, headaches, and even migraines. Now, another option that women with endometriosis may be prescribed that is also hormonal could include the progestin-only oral contraceptive or birth control pill. It has a similar function to the hormonal IUD in that it also works to thin the uterine lining and reduce the thickness of your cervical mucus to help prevent pregnancy, but it also helps to reduce painful periods in women with endometriosis. Now, with any birth control pill, you also have to be aware of the potential side effects. And the progestin-only pill can also increase a woman's risk of breast cancer and cervical cancer with long-term use. I spoke about the adverse or side effects of birth control pills in one of my previous videos. You may see the link below the title of this video if you would like to watch that video. Now, the next type of IUD that can be used to help with symptoms of endometriosis is the copper IUD. This is a non-hormonal form of the IUD. Now, what the copper IUD does is that it releases copper into the uterus of the female, and that is going to prevent the interaction between egg and sperm to prevent pregnancy. Now, with the copper IUD, it does cause local inflammation in the uterine cavity, and it's not without side effects. So if you're a woman that is less than 25 years of age, you are at higher risk for expelling or your body pushing out the IUD. Now, I want to say that most of the side effects with the copper IUD are rare, but when they do happen, they can be severe. Other side effects of the copper IUD include an increased risk for a condition called pelvic inflammatory disease. This is an inflammatory disease which can increase a woman's risk for infertility. So ladies, whenever you go to your physician, don't just hear about all the benefits of these medical therapies like the IUD or even the birth control pill. Also, do your due diligence to ask about the side effects before considering whether or not this therapy will be right for you. So I want to end this video by sharing with you what I actually did with the cyst that I had in my ovary. So as I said, when I was getting ready to do the uterine fibroid embolization procedure, my interventional radiologist said that the procedure wouldn't do much for the cyst. But I was very determined to get relief from that cyst as well. As with the fibroids, I stuck with a 100% plant-based diet. My foods were anti-inflammatory. I ate lots of berries, fruits, vegetables, cruciferous vegetables such as broccoli, kale, and Brussels sprouts to balance the hormones in my body. But there was something else I also did, which I will share with you the details of in my next video. And that was the use of castor oil packs. So castor oil packs are very beneficial to helping improve the circulation throughout the womb area to bring in cells such as white blood cells to break down tumors and even scar tissue. And so I did castor oil packs. Now I must say the castor oil packs were not as helpful for the fibroids. And I'm able to say this because I did use the castor oil packs before the procedure and I didn't get much relief. But after the procedure, I did notice on MRI that when I went back to my physician 6 months later, he also noticed that the endometrioma or the endometrial cyst in my ovaries shrunk considerably as well. And so it's important that I mention to you the use of castor oil packs because they are very beneficial in helping to alleviate symptoms of endometriosis, and coupled with an anti-inflammatory diet can help you to shrink those areas of inflammation or scar tissue in your body due to endometriosis. So in my next video, which I will be dropping on Wednesday, I will be sharing with you how to properly use a castor oil pack to help you to alleviate symptoms of endometriosis. And castor oil packs for some women can also help to shrink fibroid tumors. So stay tuned for that. If you like today's content, please subscribe to the channel and don't forget to turn on your notifications. Also, don't forget to like this video and share it with your loved ones. Take care. I'll see you in the next video and God bless.